Yep. Oh, hi. Good morning, everybody. Good morning. I'm City College of Chicago Chancellor Juan Salgado, and I welcome you to Wilbur Wright College. City College of Chicago has been a proud partner in the city's fight against the COVID-19 virus from the very beginning. I want to really extend a incredible thanks to Mayor Lightfoot and Commissioner Arwady for their just incredible leadership through this prolonged pandemic and for keeping in good communication with the public as new developments arise. I want to let you know that Wright College is one of 7 city colleges locations that are hosting family COVID-19 vaccination clinics this winter. We had a clinic just yesterday at Daly College, and today's clinic at Wright opened to 2 p.m. to Chicagoans age 5 and up. We're right in it as we speak. Families are here getting the Pfizer vaccine for children and adults. The clinic also offers the Johnson & Johnson vaccine for adults. Next weekend, families can go to Kennedy King College on Saturday from 9 a.m. to 2 and Olive Harvey College on Sunday. Then on December 18th, they can head to Truman College, and on December 19th, they can go to Malcolm X College for the shot. With the latest news of the Omicron variant, it is even more important to get vaccinated and boosted. I'm going to say a few words in Spanish before I hand it over to our next speaker. Soy el rector de los Colegios Comunitarios de Chicago, Juan Salgado. Les doy la bienvenida a Wright College. Los colegios comunitarios de la ciudad de Chicago han sido un socio en la lucha contra el virus COVID-19 desde el principio. Quiero agradecer al alcalde Lightfoot y la comisionada Arwady por su increíble liderazgo durante toda esta pandemia. Quiero que sepan que este colegio, Wilbur Wright, y todos nuestros colegios están sirviendo como clínicas de vacunación para familias. Abren a las 9 de la mañana, cierran a las 2. Y como estamos aquí hoy, la próxima fin de semana vamos a estar en Kennedy King College, el sábado en Olive Harvey College, el domingo, luego el 18 de diciembre en Truman College y el 19 de diciembre en Malcolm X College. Quiero ahora presentar e invitar a una persona que ha estado trabajando muy duro en la comunidad para asegurarse la vacunación de nuestra comunidad. Nancy Valentin, directora de Equidad de Salud en Northwest Center. I want to invite someone who's been fighting real hard in the local community to ensure vaccination of our community to come up and speak. Nancy Valentin, director of Healthy Chicago Zone. Okay, thank you.
Good morning. My name is Nancy Valentin, Director of Health Equity and Regional Lead for the Northwest Healthy Chicago Equity Zone. At Northwest Center, we recently celebrated our first dose vaccination rate of 84.6%. Northwest side, we have done a really good job, and yet we are remaining vigilant and continue to advocate for the vaccine. Every week, our team does knock on 500 doors to give residents PPE, information on our services, and a flyer to our mobile clinic located at the Bricktown Square Mall in the Alderman 36 office. Now that there's a new variant, we have to keep fighting, and our neighbors have taken notice. Our vaccination rate at our mobile clinics has tripled in the last month. Just yesterday, we vaccinated 200 people. We have worked with CDPH's team to obtain maps and other resources that have allowed us to see the census tracts that have the lowest vaccination rates, allowing us to reach out to those who need us the most. Our internal team at Northwest Center has also creatively developed an app that would allow us to track our outreach work even further so that we can optimize our efforts. We continue to reach out to families and to other residents about the children's vaccine and the booster shots. And while we know this wave can be different from the last, we are working together with our neighbors so that we could get through it safely. It's important to keep in mind that we do live in a cold state, so a lot of our outdoor activity has moved indoors. A lot of the families are getting together. So in the next week, we do plan to provide more information on more sites as families gear up, students come back from college, and they get ready for the holiday season. However, the best outreach is you. So if you've gotten your vaccine, we implore you to tell your family and friends about what led you to your decision. At the moment, a trusted messenger is our biggest ally, and we want to have you help us keep everyone safe. Thank you. And I'd like to introduce Alderman Sawyer.
Thank you. Good morning. For the record, my name is Roderick Sawyer, and I serve as Alderman of the 6th Ward and Chairman of the Health and Human Relations Committee. But more importantly today, I am vaccinated or vaxxed and boosted. But most important, those in the city of Chicago and all over the country, what's your status? We need this pandemic to be resolved, and it is resolvable. But it takes all of us collectively to get this done. So when you ask yourself, what's your status? And if your status is, I have not yet received a vax, talk to people. Like our prior speaker said, talk to someone that you trust, someone that you know, and have a good conversation about why it's important to have this vaccination, because we can beat this virus. But it's a collective effort. All of us have to be involved. All of us have to stay strong. And as I state here today, someone who has been extremely strong in this, who has been following the science and pushing the city towards 100% vaccination is none other than our mayor, Lori Lightfoot.
Good morning, everyone, and thank you so much for being here. We're here to once again urge our residents to get vaccinated. I want to thank everyone who's gathered here on this early Sunday morning. We're here in an unusual time, a Sunday morning, for a press conference because we have a sense of urgency about bringing the news again that folks need to get vaccinated. We want to thank the city colleges under the tremendous leadership of Chancellor Salgado. I want to thank Alderman Sawyer, who's been very steadfast throughout the pandemic and being our partner and urging people to get vaccinated and really leading by example in the way that he has demonstrated to folks that following the public health guidance is so critically important. We want to put the pandemic and leave it in 2021. We're down to the dwindling days of this long, hard year. But we won't be able to put this pandemic behind us if we do not step up as a city, everywhere, everyone, and get vaccinated and get boosted. We're concerned about Omicron, and Dr. Arwady will talk more about that. There's still a lot that we don't know about this new variant. We know that it's a variant of concern, but we also know from the data so far that this variant spreads faster than any other form of the virus that we've seen to date. That should be cause for concern for everyone. So we want to make sure that people can get through the noise and understand this simple message. We know that the most effective tool against the virus is getting vaccinated. We've made tremendous progress in the city, and particularly since we announced the challenge of getting to 77%. We beat our own estimate by a month, but still more work to do. We need to make sure that our seniors, 65 and older, are continuing to get vaccinated, and if you've been vaccinated, to get that booster. We need to make sure that our children from 5 to 11 and 12 to 17 continue to get vaccinated. That's a significant challenge. And as CEO Martinez said from the very beginning, it's not just a shot for the moment, it's an investment for the rest of the school year. And that, too, is critically important. I want to make sure that no one is ambiguous about the sense of urgency that we must have as a city. If we're going to move forward, if we're going to continue to make sure that life returns to normal, the vaccine is the only path forward that we have. One tool that we've been using is Vaccines at Home, a tremendous program initiated by our Department of Public Health. Every week we're seeing, week after week, that this program sells out, meaning all the appointments are taken up. We're expanding our offerings, and I'm here to announce today that we're moving this program from 5 days a week to 7 days a week because the need is there. So if you sign up, get your entire household vaccinated. We will come to you. We will bring the vaccine. We will make sure that you are taken care of. But the bottom line here, folks, is don't gamble. Don't mess around. As Nancy said, the most important thing that you can do if you are undecided is to make sure that you educate yourself. But importantly, for those of us who are vaccinated, find someone in your network. You probably know who that person or those people are. Sit down with them, listen to them, talk to them, provide them with the advice, provide them with the information, point them to the CDPH or the CDC or the Illinois Department of Public Health website, trusted sources that can tell them the facts. But we need to make sure that everyone in our city has the opportunity to get vaccinated is vaccinated. When I was in my 20s, we had a different pandemic that was raging through our country and the world, and it was the AIDS pandemic. And back in those days, groups like ACT UP and other activists coined this phrase, how many more have to die? How many more have to die? Every single day, I look at the numbers, and every single day, I know that in our city, people are dying of COVID-19. Now, the circumstances from the 1980s and 90s could not be more different. Back then, we had a federal government who ignored the crisis and the pandemic that was crushing the lives of too many people. They didn't even acknowledge it. And all the hate that sprung up at that time was truly remarkable. But now we have a federal government that is in this fight with us. And unlike then, we have a life-saving vaccine. There is no reason why we cannot use the tools that we have now, notably the vaccine, to save lives in our city. It is that approach, with that sense of urgency, that I wake up every morning and I go to bed every night. We have to step up in this time, get the word out, talk to our friends, our neighbors, our family members, people in our network who remain unvaccinated. This Omicron variant is real. It is spreading. And while it's not detected here yet, it's only a matter of time that our surveillance sees it. It's all around us in Michigan and Minnesota. It first was detected in the United States and California. It's coming here, and we've got to be ready. And the only way that we can be ready is to be vaccinated. That is critically important. So folks, get off the sidelines. Talk to the people that you know and love. And those of you who are waiting, now is the time. Do not take the chance with your life, with the life of someone that you love, with the life of a coworker, a family member. Get yourself vaccinated. Thank you. And now I'd like to welcome Dr. Arwady to give us more details. Thank you, Doctor.
Thank you, Mayor Lightfoot. So as you heard, we have not yet detected the Omicron variant here in Chicago or here in Illinois, but I do expect that to happen likely within a number of days. There are multiple examples of case investigation going on right now where we know that there are people who have been exposed to the Omicron variant, that we are doing aggressive case investigation, testing, and contact tracing on. As of today, the Omicron variant has already been detected in at least 16 states around the country. We have strong case investigation and contact tracing here. I'll remind you that every single time a Chicago resident is diagnosed with COVID, our case investigators are reaching out to talk to that person, to talk to them about their contacts. What have they been doing during the time they were potentially infectious? And then our contact tracers reach out to those individuals. It's particularly important right now if you are getting a call from the Chicago Department of Public Health, from the contact tracers, that you cooperate with that. We do protect your privacy, but it's important, especially with a new variant likely already here, that we're able to do everything we can to limit spread. I want to emphasize that this variant is a variant we are still learning about. We will have more information about the details of how protective the vaccine continues to be, probably in the next couple of weeks. But what we know, based on some of the preliminary information, is that getting vaccinated and getting boosted is really critical. There are some individual case reports that are emerging already from around the world because this variant has already been detected in many, many countries. Examples where there were people who were infectious, meaning contagious with the Omicron variant, who had a lot of exposures. And at least in the preliminary data, it looks like people who were recently boosted do seem to have increased protection. Again, we're still learning about this, but in the preliminary data from South Africa, it suggests that this variant is maybe twice as contagious, even as the Delta variant, spreading twice as quickly. In South Africa, it took a little more than 3 months for the Delta variant to outcompete, to become the primary variant across the country. It took about 12 days for the Omicron variant to become the dominant and really 90% of the COVID that is being detected in South Africa. So we've turned up all of our programs here. We're very prepared, as you know. We're testing samples from hospitals across this city. We've doubled the number of samples that we're testing here in Chicago, and there were people testing this weekend. We've not detected it yet, but it's just a matter of time. I want to emphasize, though, that regardless of Omicron, we are very much in a surge already with Delta. On Monday, 5 days after Thanksgiving, we broke a record for the number of positive COVID tests in the city of Chicago, going all the way back to January of 2021. We had more than 1,300 new cases diagnosed just on Monday. And when our case investigators and contact tracers were looking at the data, we weren't seeing anything too surprising there. We were seeing people who were unvaccinated more likely to be infected. We were seeing some more breakthrough cases and people who were boosted being less likely to be infected. And importantly, we had examples of people who had gotten a COVID test but were waiting for the results and went to Thanksgiving gatherings anyway. The test then came back positive, and we had examples of spread within gatherings. Please, especially with this new variant villain here, if you are sick, even a little bit sick, we need you to stay home and get a COVID test. You can't know whether you have COVID, whether you have a variant, whether you have a cold or a flu without the test. There are now widely available tests, including ones you can take at home, get a result in just 10 minutes, like you would a pregnancy test. We need everybody to get vaccinated, boosted, and if you're sick, please do everything you can to limit further spread. Finally, related to boosters, approximately 24% of adult Chicagoans have had a booster at this point. Approximately 47% of Chicagoans over 65 have had a booster. Both of those are just a little bit ahead of the national average, which I'm pleased about, but they're not high enough. In just 6 days, we will be 14 days before Christmas. We saw already that Thanksgiving, as expected, does lead to some increase in COVID cases. I'm worried that by the time we're talking about Christmas gathering, Omicron is also very much part of that conversation. And so next Saturday, just 6 days from now, that's your 14-day deadline. If you haven't been vaccinated, please get a Johnson & Johnson vaccine and you'll be fully vaccinated by Christmas. If you don't want to get J&J, at least get the first dose of Pfizer or Moderna. And next Saturday should also really be your deadline to get your booster to be as protected as you can be ahead of the end of year gatherings. We know what to do about COVID. The things that we need to do for the Omicron variant at this point are the same. But there are still too many people unvaccinated, unboosted, and not taking the very first piece of advice: stay home if you are sick. Thank you. And with that, I'm pleased to bring up CPS CEO Pedro Martinez.
Thank you, Mayor. Thank you, Dr. Arwady, Chancellor Juan Salgado, our Health Equity Director, Nancy Valentini, who's done a great job in Hanson Park, our Alderman Sawyer, thank you. The best gift as we approach the holidays that our families can give themselves and our children is to get themselves and their children vaccinated, to get boosters. Quiero darles gracias a nuestro alcalde, la doctora Arwady, nuestro director de los colegios comunitarios, el Chancellor Salgado, nuestro director Nancy Valentini y nuestro Alderman Sawyer. Ahorita que estamos llegando a las Navidades, el mejor regalo que se pueden dar a ustedes y a sus niños es recibiendo sus vacunas para que se puedan proteger. We know that our schools have been safe. We've seen our cases, they've always been lower than the community. And in fact, we see many times our children actually become more infected out in the community, and then cases come to the schools. And we continue to see that. Nosotros sabemos que nuestras escuelas están seguras. Los casos empiezan en la comunidad y luego entran a las escuelas. Para tener estabilidad en nuestros salones, les pido por favor que se protejan, que reciban sus vacunas. Because we know the cases start in the community, there's nothing more important for the stability of our classrooms than to make sure that our children get vaccinated. Y quiero darles todas las gracias a nuestros padres que ya están tomando esta oportunidad, que ya están llevando a sus niños para recibir sus vacunas. Tenemos en nuestro distrito 23 clínicas que tienen vacunas para niños de 12 y arriba. Tenemos 16 clínicas que están dando vacunas para de 5 a 11 años. También tenemos nuestros 4 lugares que están por la ciudad que están abiertos. Por favor, hay muchas oportunidades. También hay programas donde las vacunas se pueden ir, donde van a su casa para dar vacunas. We know that we have the ability of vaccines. At our 4 regional sites, we have 23 school-based clinics that have vaccines for 12 and over. We have 16 that 5 and 11. We have programs where they go to your home. There are so many opportunities. So again, please inform yourself. Please, again, the best gift that you can give to yourself and to your children is protect yourself, protect your children, get vaccinated. Tenemos las vacunas, por favor. El mejor regalo que se pueden dar a su familia y a sus niños esta Navidad, que se protegen y reciban sus vacunas. Gracias. Please, I'll bring back the mayor. Thank you.
Before I take your questions, I just want to make one more comment. As we've been sitting here, we see these young people, pardon me, who are getting vaccinated, and they're all coming because they get their little capes to help fight coronavirus. These children are incredibly brave and obviously being supported by their parents and guardians. Let's follow the example of these children and make sure we get vaccinated. Let's put our cape on to fight this horrible, deadly disease by getting vaccinated. Thank you. Happy to take questions.
Thanks a lot, Mayor. Members of the media, my colleague Alejandra, she'll pass down the mic to you. 2 questions per reporters, and we'll start with on-topic questions first. Do we have any? All right. Okay. Evelyn Holmes,
Thank you.
ABC 7.
Do you want me to hold? Okay. All right. I'm not used to not holding the microphone. It's really weird for me.
You can give her the microphone if you like.
It's okay. Are you, with respect to this variant, the new variant, how concerned are you about, and I don't know if the CEO wants to deal with this, how concerned are you about any possible shutdown or going to remote because of a spread? And are you encouraging people who have been vaccinated to talk to those who are unvaccinated because efforts to get those folks are not working?
Well, let me take the last question first. Look, we're here on a Sunday, which is an unusual thing for us, talking about the fact that we are concerned about the number of unvaccinated people in our city. I'm concerned for their health and well-being. I'm concerned for the people in their household. I'm concerned for their coworkers. And we've done a tremendous amount over the course of almost a year now since we've gotten the access to the vaccine. I think December 15th remarks our 1-year anniversary of having vaccinations here in the city of Chicago. But we're not done. We still have a number of people in certain neighborhoods who are still vaccine hesitant. And so we want to use every conceivable tool that we have. And one of the ways that we know works is having somebody who you trust, who themselves may be vaccinated, who says, here's what I've done, here's the process that I went through, here's the education that I got for myself, and I got the vaccine, and I haven't regretted it. Those kind of conversations absolutely need to happen. And it's not because everything else hasn't been successful. We're still vaccinating people every single day. This clinic, I think, is going to do very well today. It's sold out. And every time now that we're putting out the availability in organized ways to get people vaccinated, we're seeing great response. But we need to highlight the fact that there should be a sense of urgency. And for me in particular, with this Omicron variant that I think no doubt is here, it will be, as the doctor already said, I think will be detected sometime in the near future. The fact that it spreads at the rate that it does should be a cautionary tale for anyone, particularly those who are unvaccinated, because they are at the highest risk. Regarding CPS, I'll let CEO Martinez really speak to the specifics, but under his leadership, they've done a tremendous job in getting our kids vaccinated, making sure that the testing is in place, and really educating parents. And I have to say, the fact that we reached an agreement back in the spring with the CTU to get those teachers vaccinated went a long way, along with all the other personnel that are in the building. That's why I've been pushing so strongly when it comes to city workforce. The only way that we can maximize safety in the workplace is by getting people vaccinated. Testing is not a substitute for vaccination. It just isn't. It just gives you a snapshot in time of what your positivity is or not. But it doesn't protect you against this virus. And so we've got to keep pushing hard, both inside of city government, outside of city government, to make sure that people understand the sense of urgency and really why this life-saving vaccine is so important for them to embrace.
So as always, myself being a father of 2 children right now, attending CPS schools, we're always worried. I'll tell you, I feel a lot better because both of my children did get their vaccines. In fact, they got vaccinated officially this week, their second shot this weekend. So again, I'm going to continue to urge parents, the best way to protect our children and keep them and have stability in our classrooms is to get vaccinated. If you're vaccinated, even if there's cases in schools, we don't have to quarantine our children. As always, we'll always be prepared for, we'll always have contingency plans. But the one thing that I continue to see, and I saw this in my former district, I'm seeing this in our district now, we see more risk in the community than we do in the schools. In fact, many times studies have shown that when children are forced to be quarantined at home or to stay at home for whatever reason, cases rise up among the children more than they do when they're in school. So that is the challenge, and that is the struggle that we have, and that's why, as the mayor and Dr. Awadi have said, please just get vaccinated. We have them available now. A month ago, we didn't have 5 to 11-year-olds. We have them today.
All right, Amy Jacobson.
I have a question for Dr. Awadi and the mayor. I'll start. As you may or may not know, Oak Park, the health director in Oak Park, has shut down all sports and extracurricular activities because they had 17 cases last week. Keep in mind, they have 3,500 students. None of the students are hospitalized. Half of them are asymptomatic. What do you think of her decision, and could it happen at Chicago Public Schools?
So I'm not going to speak to the details of an investigation that's going on in a jurisdiction that I don't have responsibility for. But what I will say is that where we see significant spread or significant outbreaks anywhere, we sometimes are called upon to take action. The thing we've been pleased about in Chicago Public Schools is that we have not seen large outbreaks like this. In fact, across the whole city, just 2% of our cases in the last 2 weeks have been linked to any kind of an outbreak or a cluster. We've not seen large outbreaks. We've not seen situations with 17 people in one setting, for example, seeing spread. And again, I can't comment on the details of an investigation, in another system. We are hoping to not have to pull back on extra activities. But if we get to a point where we are seeing major spread, if there are many children who are not vaccinated, and if we're starting to really threaten the ability to provide the academic part of school, it's something we could consider in the future. I think we would be more likely to be looking at individual situations, like we have been all along here. If we were to see an outbreak in one particular school, one particular extracurricular activity, we're not making plans for any large-scale pullback right now within the schools or across the city, but we're monitoring closely, particularly what happens with Omicron here.
And Mayor Lightfoot, as you know, last night another large group of juveniles flooded the Loop in Millennium Park. They beat up a CTA bus driver. A 15-year-old was shot. A 13-year-old slammed to the ground. Their gym shoes stolen. Then they went to Millennium Park and let off fireworks where tourists thought it was gunshots and flooded. Started tearing down Christmas decorations, jumped on cars, smashed windshields. When the heck is this going to stop, and what can you do differently? Because this hasn't happened in such a high degree of a level of vandalism since July 4th.
Well, look, I haven't gotten the full readout of what happened last night, so I'm not going to credit all the things that you said. I know some of the details, obviously. Look, let me just say this. Number one, our children who are behaving themselves have a right to be any place they want to be in our city, underscoring if they're behaving themselves. If they are not, then we are going to take significant, swift action to quell any issues. Last night, there were a large number of children that were down in Millennium Park. We followed the protocols that we put in place from the summer of 2020. When it was time for them to leave the park, we made sure that they left the park without incident. And there were a number of resources and assets that were downtown to push them out of the Millennium Park area and onto the trains, because many of these kids came from neighborhoods outside of the central business district, obviously. But fundamentally, these kids have to take responsibility, but I'm going to say the parents have to take responsibility. Do you know where your kid is? Are you making sure that you are talking to your children about how they need to act and behave when they're in a large crowd? We've got to rely upon and urge and hold parents accountable as well when their kids are out downtown, just as I wouldn't let my 13-year-old out, but if she was older and she was downtown, but believe me, I would have a conversation with her before she left my household. And if I found out that she acted a fool, as my parents would say, then there'd be a reckoning and accountability when she got back home. And we have a right to expect that that's also happening with young people all across our city. I'm not the parent of these children, nor are the police officers the parents of these children. We've got to have some adult responsibility in helping us raise our kids and making sure that they're doing the right thing. I want our young people from all over the city to be able to come downtown, enjoy themselves, have fun. It's a fantastic city. It's their city. But they've got to do it in a way that is responsible and respectful of the rights of others. And if they aren't, we're going to hold them accountable. We shouldn't have to get to that point, but if we do, we will.
Thank you, Mayor. Judy Wang, WGN.
I have a follow-up with Dr. Arwady. You had mentioned that the city has doubled the number of people testing for the Omicron variant. Did I hear that correctly? Because you have cases where you haven't detected it, but there are people in Chicago who have been exposed.
That's right. So we're investigating a number of situations. There is a very large, robust case investigation and contact tracing set up, not just here in Chicago, but across the country. So, for example, where there have been Omicron cases detected in other states, and there are Chicago residents who are known to have been in exposure, we are doing that case investigation and testing. There's actually 2 lines of testing that we do here in Chicago, looking not just for Omicron, but for any variant. So first of all, we do what we call routine surveillance testing. All over the city, when people are diagnosed with COVID, an individual just gets a yes/no answer. I have COVID, I do not. There's much more sophisticated testing that has to happen after the fact to get the genetic fingerprint for that positive test, which tells us if we're seeing a new variant. So we've doubled the number of samples that we collect from hospitals, for example, all across the city, so that we have a baseline of whether we're detecting Omicron. That's number one. Number two, where we are seeing cases that may be linked to a known variant, where we are seeing examples of people having breakthrough cases, they've been vaccinated, but we're seeing an unexpected number of new cases, or where we are seeing people who were previously infected getting infected again, a second time, even a third time, or there's an outbreak, we do additional investigation in those settings and additional testing, also looking for variants. That's not new, but we've doubled the amount of it that we're doing right now, as many places have around the country, just to be able to make sure we're on top of this for when we do detect it.
You mentioned that 1,300 new cases, that was Monday, you said, right?
That was Monday, yes.
Since January?
Since almost a year ago, January of 2021. The state of Illinois also broke its testing record and its positive case record, I should say, for that day. It's a combination of 2 things. One is that we saw decreased testing over the Thanksgiving 4-day period, and we saw a lot of people who might have been tested in that weekend before get tested on Monday, but part of it is also gathering over Thanksgiving. And so, yes, that Monday broke our record.
So I think she should clarify testing versus cases.
Yeah.
She's confusing.
Sure. So yes, just to clarify, so the 1,300, that was 1,300 new cases of COVID, not just tests. But some of it is from increased testing, that's right. But regardless, we're averaging well over 600 cases a day again right now, with a positivity of 4.1%. No signs of that slowing down even before Omicron.
That's a wrap, ladies and gentlemen. Thank you, Mayor. Appreciate it. Have a good one.